Any patient with a family medicine primary care provider could be hospitalized on our family medicine hospital service. They'll come to the hospital either through the emergency department or as a direct admission from clinic, and then our resident and staff team will take care of those patients while they're hospitalized. This allows for our residents to take care of the same patients that they care for out in Casson as part of their continuity clinic in the inpatient setting. There are really very few limits to the types of conditions that we care for on our inpatient service, but really the wide range of conditions that can require hospitalization will be cared for on our service.
In the hospital, it's great because at Mayo we have every specialty imaginable. You know, family docs, we like to do everything ourselves and we pride ourselves on it, but obviously some situations warrant different specialty services, and the way we go about that kind of depends on the acuity and how the patient is presenting.
Every morning on the hospital service, we start out and do what we call pre-rounds. So they'll see the patients that have been assigned for them for that day. They'll craft a plan of care for the day, and then we get together for teaching rounds. And so right at 8 o'clock, we first have about 20 or 30 minutes of teaching on an inpatient related topic, and then we start talking about the patients. It gives us an opportunity to really make sure that we're learning about the patients we're seeing, but also covering the spectrum of teaching topics that we want to become experts in over the course of our training.
Everyone's so open to learning and teaching, and I'm able to ask whatever I want and kind of have a conversation with other specialty services and sort of work together to kind of develop the best plan for our patient. We're very eased in, whereas in other programs you would typically be front loaded as an intern, but then by the time you're a second year you have more, and there's more opportunities during your third year, which is very exciting.
We try to do a stepwise approach in terms of bringing our residents' skills up to where they need to be both be comfortable within the hospital setting as well as take good care of patients and keep everybody safe. So the way our hospital system is set up is a system of graduated autonomy. It begins with the intern who is always there working with at least one member of the care team for the first year of the program. In the second year, that transitions more towards taking autonomous call within the hospital, but always having the safety nets kind of built into our service at your beck and call if need be. And then the third year, where you take on the role of the leader of the team, including supervising both the call residents as well as the interns, and kind of being in charge of their training and education as well.
It really is a good group of diverse people. We have different levels of training, interns, senior, second year, different specialties with psychiatry, and then of course the medical students. But the beauty of that is that you get a lot of different personalities, and it allows us to have a very comprehensive care for the patient.